Hey everybody, Dr. Gerstmar from Aspire Natural Health here. Today I wanted to talk about what I think are the three most toxic health beliefs you can have that will hurt you. If you internalize these three, what I call meta beliefs, which are larger beliefs, they're really going to hold you back from getting well, and they're going to keep you in the track to getting sick. So let's, without further ado, get into it. The first of those beliefs is that health is automatic. So I don't know about you, but I know certainly when I was younger, as a kid, teens, early 20s, I took my health for granted. I was pretty lucky. My health was in pretty good shape, didn't suffer any serious issues, really didn't think about it. Didn't dawn on me that there were things that I needed to be doing on a regular basis. Now, these aren't like necessarily super complex things or, handfuls of things that you have to take. But look, if you're not eating mostly healthy food, getting some exercise, sleeping pretty well, doing these kind of things that we call the foundational habits, you're not going to stay healthy long term. Health is not automatic. It's not something that's guaranteed. So a lot of people get ticked thinking like, why do I have to do this stuff? Why I should just be healthy. I wish that were true. Look, I would love that too. But all of us, every single one of us have to get over this entitlement mindset that we are entitled to health, or that health is just automatic, or it should be something that we just have. Health, like any other investment in our lives, anything that means anything to us, we have to put some time and effort. Now, the goal is to make those things like healthy eating and exercise and sleeping and all of those things have habits and automatic, and really scale down to where we get the minimum investment, where we get the most benefit out of them. And that's what we teach our patients. But we need to ditch this mindset that health is automatic. Okay? The second toxic belief has to do with health insurance, that health insurance really buys us health. So here in the United States, we have mostly private health insurance where we or the company we work for buys health insurance for us. Other countries have a more, government-funded or more socialist type of healthcare system. Regardless, the idea is that health insurance buys health. And look, anybody who's been to a doctor anytime recently knows that's not true. Health insurance is really disease management insurance or emergency medicine insurance. Look, if I get in a car accident just like anybody else, I want to be rushed to the hospital, newest procedures, techniques, everything, please save my life, right? But otherwise, if you go to a doctor, it's basically, what's your problem? Here's a medication or surgery to help deal with that problem, right? I spoke with a guy just yesterday. He was talking about GERD or heartburn and how the only option he'd been given by his MDs was to take the proton pump inhibitors that we've talked about elsewhere. And his question was, do you guys take health insurance? And my response to him was, it's not that we do or don't take health insurance. It's that the care that we want to provide for you, actual health care, improving your health, preventing future disease, and getting to the root cause and resolving it for what's causing that GERD isn't something that health insurance pays for. So while most of us who are listening to this are lucky enough to have some kind of health insurance, I hope, counting on that to care for our health is a toxic belief. The reality is that health insurance is there to help us manage disease and take care of emergency situations. But our actual health care, the things we do, are things each of us need to invest in, buying healthy food, maybe a gym or some exercise equipment, all of those kind of things. And my belief, getting a good preventative and healthcare-oriented team on your side is something we all need to invest in. The third toxic belief is that if we have a problem, it's pretty much going to stay the same. So one of the questions that we ask people in trying to understand what their motivation is to get healthy is, if you don't do anything about whatever your issue is, where do you see it going over the next few years? And I would say 80 to 90% of people say, it'll be about the same. So my GERD, my autoimmune disease, my digestive problem, my thyroid problem, whatever the issue is, A lot of people seem to think that if they don't take some action, they don't try and resolve it, fix it, make sure it's really well managed, that it's basically going to be about the same down the road. The reality is, I'm sorry to say, where in your life is there a problem that you don't deal with or don't adequately deal with that down the road is exactly the same? If you're like me, my life, the problems that I don't deal with, they don't go away. They don't stay the same. If I don't deal with them, they get worse. We think of it like, look, if there's a funny noise in your car and it doesn't just go away, a little acute problem that sort of works itself out, right? Like minor colds and flus, aches and pains, those kind of things. Yeah, you can probably ignore them and most of them will go away. But something that's stuck around for a while, it's an issue. So your car makes a strange noise and you just think, well, if I just leave it alone, it'll go away or it'll stay the same. Basically never happens, right? If your roof gets a leak in it, you think, meh, I don't want to deal with that right now. It won't get any worse. The reality is that's just wrong. So if we don't take care of our health as dysfunctions, as issues come into it, if we don't jump on that and take care of it, the reality is those problems are just going to get worse, right? So my plea to you is please, one, recognize that health is not automatic. It is not a birthright. It is something that we have to cultivate over time and over again, which is why we put so much emphasis on the foundational habits. What you eat, movement, getting enough sleep, managing your stress, and having good social support networks are the 5 foundational habits that, if nothing else, ensure that you stay healthy. And then we talk about things like good hormonal balance, detoxification, and mental emotional health as other factors that are involved, the pillars that are involved in keeping people healthy. Health isn't automatic, it's something we have to take care of. Health insurance, unfortunately, is not about health. It's about disease management and emergency medicine. If you're looking for more than just managing your disease, primarily with medications, or taking care of an emergency situation, broken bones, car accidents, those kind of things, then you need to view health as an investment instead of a cost or something that health insurance is going to pick up. And thirdly, that problems just stay the same, and if you don't deal with it now, it won't get any bigger, badder, or worse. The reality is we need to take care of our health, we need to invest in our health, and we need to start today. Because if we don't, things will just get worse. These are the 3 most toxic health beliefs that I believe that if you change these to say health is something that we need to be working on a day-to-day basis, health is something we need to be investing in, and any issues, problems, or dysfunctions need to be taken care of as soon as possible. I believe if you internalize those 3 beneficial beliefs in place of the 3 toxic health beliefs, you will be a great deal of the way to leading a healthy, happy, and optimal life. If you'd like to hear more from me, more from us, please look us up at Aspire Natural Health. That's aspirenaturalhealth.com, or on Facebook /Aspire Natural Health. Till we talk again, take care.